So for the two types of patients, the people that still have teeth, but it's been determined they have to remove them all, or the denture wear, what's the process like from step one to where they get their teeth?
Great question, Randy. So typically they're going to come in for that first day, that consult. I usually offer these free. Come in. We'll take a 3D X-ray because usually someone's going to come to me and say, "Oh, my dentist said I don't have any bone for implants."
But it is true. If you've been wearing a denture for like 20 years, you can't do this. You don't have enough bone.
Absolutely false.
Really?
Absolutely false. That is not true at all. I have, in my career, I think I've only found one patient that did not have the bone for it, and that was due to just some very severe issues.
Is it because of the newer techniques?
The newer techniques, the newer technology, the better implants, the training that I've received. Yeah, most dentists will look at the X-ray and say, "Nope, you're going to wear a denture." With the experience, when you go to somebody that knows what they're doing, knows how to do this, that's very rarely an issue.
I interrupted. So step one is determining whether they're a candidate.
Yeah, so are they a candidate? So we'll do that the very first appointment with proper imaging. We'll take a 3D image. We'll do a 3D scan of the mouth if they have teeth or if they don't have teeth. We'll do a smile design that first consult appointment. We'll show you what you would look like if you had your teeth done. And then we schedule the appointment. We'll do a pre-op appointment, typically 1 to 3 days before the surgery, where we'll go over consents, talk about everything that's going to happen. If we need to give you any prescription medications or talk to your doctor, we'll do all of that beforehand. And then surgery day.
They walk out with teeth that day?
Yes, that day. Usually just within a couple hours.
And you're printing the teeth in the other room? Like you have this in-house lab?
Yes, sir. Yeah, so what will happen is while you're asleep, we're going to do the surgery. We're going to do any necessary scans or photos or things, again, while you're sleeping. We'll make the teeth right there. I have a lab guy that'll be there for the procedure.
Okay.
We attach the teeth to the implants, again, same day. You wake up. It'll feel like you were asleep for 3 seconds. It's usually about 2 hours, and it's done.
How soon can you eat?
That same day.
Is that right? Just like take it easy at first?
I start you off a little easier. I'm going to say stay kind of more on softer foods, a little softer diet in the beginning. More just to make sure everything is going to heal well in the bone underneath. We just give that some time. So before you know it, once you're fully healed, you're able to eat anything you want.
Like a carrot with your front teeth, or you have to be careful with front teeth?
No, anything.
So whatever you can eat with regular teeth.
Whatever you can eat with regular,
actually, regular healthy teeth.
Stronger than regular healthy teeth. I usually tell people you can bite that chicken bone in half. You don't need to, but you could. Very, very strong. Bite and chew anything you want.
So 3 steps.
3 steps.
And so somebody look, you'd have to have an opening in the schedule. But literally the day after tomorrow, somebody could be in their new teeth.
They could.
Is that true?
It's very true.
Okay, good.
Yeah, it's unbelievable. And people don't even believe me about the post-op pain. They say, "Oh, this is going to be terrible. I'm going to be in a lot of pain." It's not true.
Because of the precision in which you're doing it today?
Yeah, so it's interesting because I see a lot of my colleagues will post these online, these before and after photos, and usually the day after or 2 or 3 days after, people are swollen and black and blue and bruised. I just don't find that. I think some of it is because of what we put in the IV. We're putting some special anti-inflammatories and things in the IV to reduce swelling. Some of it is the technique. When I do it, it's much easier for me to do the procedure when you're sedated, but I treat you as if you're awake. I'm going to be very gentle in my incisions. I'm going to be very gentle in how I'm doing the surgery. And I find even afterwards with how I place my sutures, my stitches at the end, if you need them, very precise in a way that makes you heal faster and have very little, if no, post-op pain at all.